Getting out from long months in quarantine due to the current coronavirus outbreak, one might say that they already developed some mental illness such as depression or anxiety disorder. While they are two different medical conditions, their symptoms, causes, and treatments can often overlap. Despite the fact that they are commonly talked about topic, people still struggle sometimes to determine the difference between these two conditions. This is because many people with anxiety also develop depression and vice versa. Roughly 50% of people diagnosed with depression would also be diagnosed with an anxiety disorder. However, it's important to get an accurate diagnosis in order to treat the correct conditions. These are the risk factors for developing depression and anxiety. Biochemistry. Differences in certain chemicals in the brain may contribute to symptoms of depression and anxiety. Genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. Personality. People with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic appear to be more likely to experience depression and be more anxious. Environmental factors. Continuous exposure to violence, neglect, abuse or poverty may make some people more vulnerable to experience anxiety and eventually develop depression. Many people with depression may experience what is known as anxious distress in addition to their low mood. People with anxious distress often feel tense, restless, and have trouble concentrating because they worry so much. They are deeply afraid that something bad is going to happen or that they might lose control of themselves. People who experience anxious distress with depression may be at higher risk for suicide or need more intensive treatment, so it is important to identify these symptoms along with the depression. Symptoms of depression are depressed mood, lack of interest in enjoyable activities, increase or decrease in appetite, insomnia or hypersomnia, slowing of movement, lack of energy, feelings of guilt or worthlessness, trouble concentrating and suicidal thoughts or behaviors. For a diagnosis of major depressive disorder, a person needs to have experienced 5 or more of these symptoms for at least 2 weeks. Symptoms of generalized anxiety disorder are excessive worry, restlessness, being easily fatigued, trouble concentrating, irritability, sleep disturbance and muscle tension. If you've experienced these symptoms most days for more than 6 months, and they cause distress in your daily life, then you may receive a diagnosis of generalized anxiety disorder. If you have anxiety, depression, or both, chances are that your doctor will recommend medication, therapy, or a combination of the two. Keep track your symptoms and keep a log of how you feel each day, as this can help in the diagnostic process. It's also important to speak up and ask your doctor whether they think you have depression, anxiety, or both. This clarity can help you understand the treatment focus and how to manage your symptoms. Never hesitate to ask about your diagnosis, as you have a right to your personal health information. The most important quality that anxiety and depression share is that they are both very treatable conditions. Never hesitate to find people to help you stay informed and on the right track towards a healthier mind and body.